there was some comments about people who have actually lost weight on a healthy diet, and they're actually concerned about losing too much weight.
Yep.
Now, I know you use the phrase, I know Dr. Ken Berry used the phrase of attaining an optimal weight. It's an optimal weight diet. So if you're too skinny, it can increase weight and so on and so forth. But there is one key exception here. And there's a condition of type 1 diabetes that can often afflict adults. So about 10% of people diagnosed with type 2 diabetes may, in actual fact, have a type 1 variant where there's not enough insulin. It's got a bit of a funny name. We call it LADA, or latent autoimmune diabetes of adulthood. Now, the problem with LADA is that while you may or may not have insulin resistance where your receptors aren't working properly, you also have a deficiency. Your pancreas simply cannot make enough insulin. And you'll recall we talked about how type 1 diabetics present. They present emaciated. So if you're a diabetic and you have unexplained weight loss, or you can't put on muscle, or so on and so forth, then I encourage you to go to your doctor. Please speak to your doctor about that. So if you're having trouble gaining weight, it's not necessarily a function of the diet. It could actually be a function of your disease. So please get checked out.
How would they determine whether they've got LADA or not?
Well, so this is obviously what their doctor would do.
Yeah.
So the doctor would do some blood tests. So the first blood test that most doctors will do is looking for something called antibodies. We look for evidence that your immune system is actually attacking the pancreas, the organ that actually releases insulin. And if we see that, then we say suspicious that your insulin levels would probably be low. The gold standard test, which is unfortunately not done as widely as it should be, is what we call a Kraft test. It's an oral glucose tolerance test, which is like the test you get when you're pregnant, except we also add in insulin. So what should normally happen is that if your glucose level was high, your body should say, oh, I need to lower that glucose level, so I'm going to release a certain amount of insulin. So if at any time over this 2-hour test we see that your glucose levels are high and your insulin levels are inappropriately low, then we know that your body is struggling to release enough insulin. So that's how you'd tell. But yeah, if you're having trouble gaining weight, or if you're losing excessive amounts of weight beyond what you feel is reasonable, then please go see a doctor.
Okay.